same
eras.
Yeah.
College.
Yeah. She's an ardent educationist, and you will see that how you enjoy her lecture. She's a beauty with brains and very graceful in her talk, and she will really keep you connected. She's going to talk about assessment of ethics, professionalism. See, when you don't assess, people will not be able to take it seriously. They don't respect it. If you don't inspect, they don't respect. So she'll make it so interesting for you today. Over to you, Sucheta. And I'm so glad for
Thank you
accepting.
So much, Sunagha.
Yeah, yeah. Thank you.
Pleasure.
Yes.
Yeah. Yeah. So hello everyone. Good to see all of you. And good evening. I will start sharing my screen.
Good evening, ma'am. Good evening, ma'am.
Good evening. Are you able to see my slides?
Yes, ma'am.
Yeah. Okay. Oh, I don't know what happened. Anyway, I think I'll share again. Yes. So we're going to talk about, I thought I'd just, initiate a little bit about professionalism and ethics, and then we will go on to talk about the assessment. So far, have you, I have not really seen, what all you have done so far. Have you done the assessment part still? Assessment, general aspects of principles of assessment? Can anyone answer? General aspects of assessment?
Yes, madam. Actually, different types of assessments have been covered.
Okay, very nice, very nice. So it makes my job much easier, and it will also help you to recap and see what more can be added. This is something that we should think of. Can we be able to make a module or introduce professionalism and ethics, the part of that as an assessment tool, and as how can we add it to our day-to-day dental education? That is what you should be thinking of as I go forward. That how can I use this for my students in dental education? So what is professionalism? When I say professionalism, what comes to your mind? Something must be
Ma'am, work related.
Work related. Yes,
Work.
yes, work related. What
Time.
else? Huh? Pardon?
Time.
Okay, time. Yes. Anyone else?
A best way of doing any given job with better skills and excellence.
Yes.
Professional integrity.
Excluding purse.
Perfect. Professional integrity. Someone said something else. What's excluding?
Personal things, ma'am.
It is related to your profession, no doubt. The word only has profession in it. So it
won't depend on your mind. It depends on your skill more, but professional.
Pardon, is that Jyoti talking?
Yeah, professional mainly it involves the skills and mind rather than hard labor. Hard skills, and compared to hard skills, you require soft skills for professionals.
Yes. All of you are absolutely right.
Collaborative approach, ma'am. Not working in silos.
Not working in silos, working together, seeing that you work in a team, and you are respectful to others.
Each other, yes.
Showing respect to each one is a very important part about professionalism. So if you look at the large definition of professionalism, it is the ability of the individual member of the profession. So when I'm saying individual member of a profession, it means we're looking at the whole team. All right. To demonstrate their acceptance of their professional responsibility and accountability by being able to justify their actions to the patient or client, their profession, and the society in which they work. And not just the society, they should be able to justify it to themselves. So in a way, professionalism is to do with one's conscience also. I mean, suppose you do something, there are times when you do something or you say something to someone, and somewhere your conscience pricks you. Somewhere you feel, ye kuch theek nahi hua. Or maybe I shouldn't have done this, or maybe I shouldn't have said this. So that feeling of uneasiness is also leads to professionalism. So in short, professionalism is the organized autonomy to carry out work which requires specific expertise and which is justified by accountability. We have to be accountable to the society, to our institute, to the place that we work in, and not just that, but to ourselves also. And that involves professionalism. So what criteria come to your mind? There, quite a few of you mentioned a few. So can you again once more say, when you say professionalism, which criteria come in mind? Someone talked about time. Someone talked about knowledge, not knowledge. They talked about soft skills. So what else?
Working together, ma'am. Collaborative approach.
Collaborative approach.
Dedication.
Pardon?
Dedication, ma'am.
Dedication. Yes, dedication. So there are so many things, I looked up, I'm not, I looked up all what for this talk that I've prepared, this session that I've prepared. I have referred to only dental journals because I wanted you all to understand from a dental point of view. I mean, there is otherwise the literature is, so much literature is available on assessment and professionalism and ethics. But I thought, let us just think about it from a dental point of view. And there was this assessment of professionalism in dentistry, and there is this thesis that is available on the net. The full thesis is available, and it's from the University of Sheffield. And this student has listed out so many of the themes that she generated, during the course of her work. She talks about altruism. Altruism is the selfless act of helping others without expecting anything in return. I mean, suppose you have a patient who really needs some help and doesn't have the money to do some root canal, and then you try and find out a funding for him. I mean, I'm just giving you an example. Or you just say that normally I would charge, say, 100 rupees, but for him I will charge 50 rupees, just the cost of the material that I have used. So and that if you do this good deed, that patient is not going to be able to give you anything in return, but you have done a selfless act. So that is altruism. By working selflessly without expecting anything from that person in return. Accountability. I don't have to tell you what accountability is. You are accountable for your actions. I mean, sometimes, I'm not a very spiritual person, sorry to say that. But there are times when somewhere in the back of our mind, because of the upbringing that we have had, we always feel accountable, if not to the world, but at least to ourselves, because our conscious or our upbringing or our culture is making us feel that maybe ye theek nahi hai. Autonomy. You have to give people, there has to be certain amount of individualism that is there. You have to give people, in order to see that professionalism and ethics is there, that it is to be individualistic also. Then many of you mentioned, not in so many words as compassion, but to do good, excellence, honesty and integrity, knowledge of ethical standards, moral reasoning. I mean, moral reasoning is something that, we do all the time when we are reflecting, when we are thinking that if did I charge this person too much for the implant just because, he came in a Mercedes, the patient or anyone came in a Mercedes. So you feel, अरे ये तो 30,000 में हो सकता है तो अभी 60,000 ले लेंगे. Yeah. So somewhere, but there has to be some kind of a moral reasoning also. And then when you do this reasoning, there has to be a reflection also. And self-awareness. You should be aware of what is around you. And it doesn't mean that you do so much good that your family suffers and you're not able to pay your children's fees. There has to be a proper balance. I mean, I always feel that whatever said and done, we are all working for ourselves and for our families also. So you don't have to be so selfless that in this whole selfless business, your family suffers and you are not able to put your children into a school that you would have liked them to put them in. So these are having a right balance in life is so important. Self-motivation, and particularly with a respect to lifelong learning, a social responsibility, trustworthiness, and also cooperation, as you all said, working with others. So most of this, all of you mentioned, but now these are the criteria or the themes that were devised in this thesis. And so having said that, we come to the idea of ethics. What is ethics? Ethics simply said, ethics is the study of what is right and what is wrong. It is the process of determining the most morally desirable course of action when confronted with a situation where a decision is required. And ethics and professionalism go hand in hand, and they're important parts of our dentistry practice, and they need to be addressed, and how we address them needs to be looked into. So what influences whether a person acts ethically or not? What is it that is there? First of all, it is our background, our faith, our values, and religious and cultural background also come into play. That is why I feel sometimes that religion also plays a very strong way in which it holds people together, and it also each and every, the Quran, the Bible, the Granth Sahib, the Gita, all these books talk about what in a way what is right, what is wrong, and they also bring about the shades of gray, so to say. So it is important, and so one's upbringing, one's school, one's friends, all of them have an important effect on us, and everyone's collections of past experiences also help us to have a ethical reflection, and it's a strong driving force in how we make our own ethical decisions also. So for dentists, there are additional factors influencing one's behavior beginning in dental school and upon entering your practice. Role models, who are people we look up to, having qualities who we wish to attain, are a strong influencing factor for professional values, attitudes, and behaviors for dental students. Compassion, integrity, and good relationships with their patients were attributes most valued in the role models. So if you were to take an interview or to find out from your students, what is it that you look up? And I'm sure you will notice that the way a person behaves is always held in high esteem. So can we teach, these are questions that I want you to think of and ask yourselves. Can we teach dental students to act ethically? Is there value in taking the time in curriculum to teach ethics? How should ethics be taught to dental students? What will you do to teach ethics to dental students? That is something that you need to think of. And this is the oft repeated diagram, which you will see in any lecture that is taken on ethics, which talks about the first, our grounding, our basics is in the clinical competence and knowledge. And then it goes on to the communication skills and the ethical and legal understanding. And this ethical and legal understanding is then has these pillars of excellence, humanism, accountability, and altruism, all of which will lead to professionalism. So professionalism is right at the top there, but it is built on all this. Unless we have good knowledge, unless we have good communication skills and an understanding of ethics and legality, all our practice will fail. And that is the reason why all this is at the bottom, because they form the foundation. They form the foundation, and then you have the pillars of support for professionalism. This concept of sustainable development of modern dentistry was a 2020 paper which I have taken. And here, they have made this very nice sort of two wheels, and how they are integrating into each other. One is features of the profession and how they are intertwined between the dental ethics. So you have features of the profession, which is serving of the society, assessment of competencies by a professional group. That means your Dental Council of India will talk about how are you assessing, authorized groups, knowledge and skills, and ethical practices. All this is intertwined to dental ethics, which includes patient autonomy, non-maleficence, beneficence, justice, and veracity. All this, even general ethics also involves all this. So when I say veracity, I mean conformity with truth or fact or accuracy. That means you are truthful, and you do not twist facts, you do not twist things, and you have a very ethical approach. You can always say that when see, our patients are bound to ask, why is this implant costing 5 rupees and the other implant costing 10 rupees? I mean, just for example, say, if you can ethically and tell them that what goes into the 5 rupee one and the 10 rupee one, and justify why you're going to charge the 10 rupees, and you have put all the cards on the table for that patient to make a decision whether he can avail of the 5 or the 10, then that amounts to good ethical practice and veracity, maintenance of veracity, that is conformity with the truth or the fact, and you are being accurate with your data. Another aspect is respect for autonomy. What is it? It is the duty to respect a patient's right of self-governance. That patient has a right to understand and to make a decision कि ये 5 रुपए का चलेगा कि 10 रुपए का चलेगा. All right. Non-maleficence. It is a duty to avoid causing harm and to minimize harm to the patient. Beneficence is the duty to maximize benefits and to enhance patients' well-being. And justice is the duty to treat patients fairly and equitably. See to it, and this forms the entire principles of ethics. And then you have a lot of this linking with the values and the behavior. When we say that you should have responsibility is a value, what does this mean? How will it reflect in the behavior? Follows through on tasks, arrives on time. Someone mentioned, when I said what is the criteria, someone very rightly said time. Time is money, time is God. There are so many, if you were to Google any of these idioms or proverbs related to time, and you will find 1,001 of them, because everywhere, all throughout the world, globally, locally, everywhere, people have understood the value of time. And that is when you arrive on time, you're being responsible. Maturity. To accept the blame and the failure. there's no need to, keep on apologizing or saying that this is sorry. But if someone keeps back coming back with some pain, and then you realize that there is some small fault that is there, you can say, this has gone wrong a little bit, but I will improve on it and I will set this right. So it is always, and there's so much off your chest if you just say that much, that this alignment of the bridge was a little has gone a little haywire, but we will try and do something to improve on it. Okay, it's okay, fine. Doesn't make inappropriate demands, is not abusive and critical in times of stress. This is very important. Only when you are, I mean, there are times when this can happen. In fact, I want to tell you all about the national conference in health professions education that we are organizing in Lucknow. And I would love all of you dental faculty to be there with us, because it's a health professions conference and it's a national one. And right now I thought about this stress, etc. And we are in the process of making our website, and because it has to be launched day after tomorrow, our tempers are rising. I just came back ever so tired. I've been working right from 8:30 in the morning today, and I just barely made it for this class. And there was a time when I just lost it. But then after that, as I left, I just said a sorry to everyone, with that as I left. And I said, please no one take all this to heart. We're so stressed that I may, this kind of a bombardment just came out of me, and I'm sorry about it. Maybe they took it well, maybe they did not take it well. But as I walked up and got into the lift and came here to take the class, my mind was at peace. I just felt that I know I did wrong. I know I should not have said what I said, but at least I made my amends by saying a sorry. So these things help to not only keep your psyche, but it also helps maybe to make other people feel that at least she cared for us to say that, it was not the right thing to do. Then the communication skills. Remember, it is very difficult to listen well. Yeah. So we have to learn to take time off. I always say, take 2 minutes, count up to 10, and then ask again. So listen to people. If not is not hostile, derogatory, or sarcastic, is not loud or disruptive. All these make for good communication skills. And show good respect. Maintain patience, confidentiality. Be patient. Is sensitive to physical and emotional needs, and is not biased or discriminatory. That is also very important. So now we move. I mean, this was like a prelude to tell you what all is involved in professionalism and ethics, because I felt if we don't know what is professionalism ethics, hum assessment kya karenge? All right. So we need to think of that. So assessment for healthcare professionals must be reliable, valid, acceptable, and cost-effective, and must demonstrate educational impact. That is what the great educationist Van der Vleuten said. Professionalism has to be assessed as both a competence in its own right and as a part of our clinical or dental competence. And some authorities include communication within the definition of professionalism. So that is very important. And this is something that I have taken from a paper on dental education. Assessing professionalism within dental education is there is a need for a definition. In order to enhance dental education via the assessment of students' professionalism, the first step is to define professionalism in dentistry and develop a validated operationalized construct. Then educational programs can be developed which teach professionalism, and students can be assessed on the domains within this construct. So you can imagine that this is what is needed. That is why, if you were to Google and search for material, there is not a lot of material that is available. But this was one good paper that I found, and I thought I would sort of mention it to you all. and it's very it mentions how to assess. And in fact, if any of you were ever to do a project and would want to use professionalism as one, then this is a good place to start with. So, but what do you think are the challenges? I've been talking for too long. Can I have you all tell me, what do you think are the challenges for doing all this? You know, I mean, I said a lot. What do you think would be the challenges for us to put it into action?
Ma'am, standardization.
Ma'am,
Standardization, yes.
the difference of opinion, ma'am.
In a way, you're right. You know, differences in opinions, because what may be wrong for someone may be just a shade of gray for another one. Right? I'm just hoping that what is wrong for someone is not absolutely right for another one, but it could be a shade of gray. You know, I'm always scared that would be. I mean, what is playing currently on my mind? Sorry, and there's this electricity blackout. So, but you can. I think it's okay even if you don't see me. But what is weighing terribly on my mind right now is that case of our NEET result. You know, and what happened in some centers where I mean, you copy to such an extent कि पूरा का पूरा mark के लिए तुम लोग copy करो. I mean, this is where ethics comes into play, you know, and how much can you cheat and how far. So I'm just hoping that no one ever feels that जो हुआ वो ठीक हुआ, you know. We need to try and think of all these aspects also, and inculcate in our students and our families and our children, you know, that how far can all this take us. That has to be understood or realized. So when it comes to the challenges, see, the challenge is, suppose something happens and there is who will decide? There will be a committee who will decide whether a person has done right or wrong. All right, but it takes a lot to throw a person out of the system. You know, very difficult to expel a student from further studies. You know, unless it is very gross. What you can do is at the most ask them to repeat a term, and that is what most of the time happens with our universities, etc. But at least being caught in the act and being punished, we hope that the students will understand कि ये ठीक हुआ और ये नहीं ठीक हुआ. You know, inadequate professional behavior is often exhibited during early stages of training. So this is it. This is the example. You know, 12th standard खत्म नहीं हुआ तो तुम ऐसे behave करोगे. So when you go into professional colleges, what will you do? Then, if the inadequate professional behavior is to be remediated, there needs to be time for this and for review. We always face this challenge where people will say, अरे जल्दी जल्दी उसको पास कर दो और उसको re-exam दे दो because ये इसमें copy किया था उसने, but फिर भी अभी उसने we gave him 1 week of repeat, but he should have joined the next batch somehow. Yeah. So then we have to just give him a re-exam and send him out. So many things happen, you know. So these are challenges that all of us face. And though we are telling people, nahi, ye theek nahi hai, I don't want to do this or whatever, sometimes it falls on deaf ears. And sometimes it can also cause a lot of heartbreak and problems to us also. So coming to that, you know, coming back to the point of assessment, we need to remember Miller's pyramid. Do you know this Miller's pyramid?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
So the assessment can be done by testing knowledge, by testing competence, by testing performance, or by testing the action. That means by asking knows how, shows how, and does. these are the assessment tools that I thought of, which you could use to assess professionalism. Okay. Mini CX, vignettes, standardized patient encounter, narratives, and multi-source feedback. I know that we are only about 10 of us, I think, in the class. So instead of putting you into breakout rooms and then, making you all talk, what I was thinking of is, if I will give you 10 minutes, all right? Do you have a paper and pencil, paper and pen on you nearby? You can work?
Yes, ma'am.
Okay. I don't
Yes,
mind you even using your Google, do what you want. Huh? It's not like an exam or a test or something. Google, do what you want, and find out how you will use mini Excel to assess professionalism. You may not get the answer directly in Google, and the time is also short. Uh, we can take 15 minutes. It's 6:30 now by my watch. You can take till about 6:45. Each and every one, you find out for yourselves how you can use these tools to assess professionalism. All right. 5, so 2 to 3 minutes you will get to find out. Use your own common sense also. Somewhere if you don't understand, Google, do what you want. All right. We
So
will meet back.
two groups, two breakout room.
No, madam. Let them do it individually. They can do it individually.
Okay.
And then they will let us know, and then we will discuss it. It's not much. It's just 10.
Okay.
Huh? Okay. Yeah.
Okay.
So all of you work on this, and we will come back in 15 minutes.
Yeah, that's good. That's good.
Yeah.
Yeah.
Thank you. I am here, though my video is off. If there are any questions, please unmute yourself and ask me.
Madam, the second one, vignettes. Could not understand.
Sorry, I missed you. What did you say? What you did not understand?
The mini 6, I know, madam. This second point.
Vignettes.
Yes,
clinical vignettes, clinical stories, clinical scenarios.
Okay.
Any scenario.
Okay.
Yeah.
Because mini 6 also it is similar to that only, madam.
Mini CX will not be similar to vignettes. Vignettes are a case scenario where you will ask the students to opine. And mini CX is mini
Even
some
videos can be used, madam, in this.
Yes.
Mini 6.
Yes. Some you could use a vignette in mini CX also.
Okay.
Yeah. Right.
Ma'am, excuse me, ma'am. Do you have to say the domains under the dental professionalism?
No, there's no need of the domains.
Then what exactly are you like,
If you
ma'am?
yes, you can just mention that what it will do. Whether you will do, you can mention, because
Ma'am,
that will form the basis of your answer.
I have made 5 points. Can I tell them?
No, just wait.
Okay.
Another 3 minutes.
Okay.
Let the 3 minutes, yeah, and then you can go first.
Hello. Hello.
I just got logged out. I got logged out and I was having issues with the network, but here I am, thankfully. Back just in time. Right. So, can you see my slide? So I want, I think someone wanted to report out first.
Yes, ma'am. I'm Dr. Mirna. Yeah, Mirna.
Who?
Mirna.
Yeah. Okay. Yeah, go ahead.
Ma'am, I have kept
Mirna.
5 domains. Yeah.
Yes.
First is the communication skill, how the dental professionals are interacting with the patient. Have they taken their consent or not? Are they actively listening to the patient? Second is the second domain is the ethical practice and integrity, whether they are able to maintain the patient's confidentiality and honesty while doing the treatment of the patient. Then third is the empathy. Are they empathetic to the patient? Fourth is responsibility and reliability. Are they accountable for any mistake they have done? Do they feel responsible towards the mistake they have done or towards the treatment they are going to infer to the patient? They are going to confer to the patient. Fifth one is the clinical competence area. That is whether they are able to properly take the history, do the diagnosis properly and able to reach a decision after the end of the diagnosis. Whether they're able to do the required procedural skill correctly and do the patient management. And for this, I have used the Likert scale 1 to 5, where 1 is the below expectations and 5 is excellent and 3/4 are above expectations.
All right. But what about the tools that I have mentioned? How will you relate all that you have said to the tools?
In the while the dental professionals are working on the patient, we have to work chair side. We have to assess them chair side.
Okay. Okay. Any other comments? Anyone else would like to present?
Without interfering in their work.
Pardon?
Without interfering in the operator's work. We simply have to assess them.
Okay. Assess
Actually,
them using these tools. Assess them using mini-CX, vignettes, standardized patients, narratives, and multi-source feedback.
yeah,
So can I have someone else also?
Ma'am, can I
actually you
explain?
asked.
Yes, please. Who wants to go next?
Ma'am, I am Dr. Arun Kumar. Ma'am, I'll be explaining what is each tools mean, how they are applicable, and how we can use it for assessment.
Okay. Okay. So thank you. Yes, go ahead.
The first one is mini CX. The complete nomenclature of mini CX is mini clinical evaluation exercise. Here we give a correct or a real clinical setting to the student or the professional. So what we do here is we evaluate professionalism by assessing how the student give respect for the patient, ethical behavior, his accountability and appearance during clinical tasks. And it is assessed by using any of the standardized rubrics, giving importance to the rate of professionalism and its consistency and objectivity followed.
Right. Right.
Then next is
the vignettes.
Vignettes is a kind of a hypothetical situation that they are provided to the student where here.
All right, just wait a minute. Would anyone else like to add anything to what he said as far as mini CX is concerned? So we don't have to have a report out from everyone. Everyone thinks, and now that he has mentioned mini CX and he has told us what can be done, can anyone wants to add anything?
Yes, ma'am. I just want to add to that.
Ma'am, can I say one?
CX is used for multiple evaluation and it gives targeted feedback when compared to other tools.
Madam, it is a real-time workplace assessment. In the workplace scenario, like
Ma'am, I have one doubt. Like mini CX is for the simulated clinical environment, and DOPS is like for real clinical scenario.
I just want to add to what Arun sir said, madam. So in the mini CX, you can play in a video format, and then you can ask the student to reflect what is wrong or what is right in that video, so that the students can properly understand what is the professionalism.
Even the doctor-patient relationship also can be evaluated. If it is clinical scenario, doctor-patient relationship, time management, and interprofessional relationship or interpersonal relationship can also be assessed.
I think ma'am is not there.
Oh, right. Nobody is there.
So we may have to repeat our
I am there.
So discuss now among ourselves.
Sir, host is there, sir.
Real-time assessment.
That's
and
okay.
Real-time feedback.
Yeah.
Ma'am has joined back.
All right, but did you continue with the discussion?
Yes,
ma'am.
So again, independence.
Everybody, can we just have everybody video on so that I will take a snap? I think only today we are all full.
Yes,
full
1,
class.
2, 3. Yes.
Oh,
Once
nice.
in a blue moon.
Yes,
Jyoti
yes.
ma'am.
Siddharth.
Yeah.
Jyoti ma'am.
Yes.
Siddharth,
Yeah, madam.
Please.
video on, please.
Yeah,
I will click on. Yes. Yes.
Take a screenshot, madam.
Yes, yes, sir.
Yes, take, madam. Take.
Done.
Thank you.
So we'll continue with you all mentioned many CX, right? I think mentioned. Can you hear me?
Yes, ma'am.
Yeah, madam.
Yes,
Yes,
ma'am.
ma'am.
Yes, ma'am, we can.
Right. I'm so sorry about this. It's never happened before. But and then vignettes. Did you mention vignettes?
No,
No, we not
only
started it.
Okay. Then can we go ahead with the vignettes?
Yes, ma'am. Vignettes are nothing but a hypothetical scenario which has been presented or a challenging professional situation which is being told, where here the student discusses about that scenario, and and he can also assess in the form of his written responses to discussions. Its evaluation is based on this ethical criteria or empathy and integrity that he shows on this as a hypothetical scenario which is being told to the student.
Correct. Perfect. Anyone wants to add anything to this?
actually witness. This is mainly used for evaluating decision making. Like if they for critical thinking skills, we use this tool, I think. And this is a standardized assessment for multiple candidates when compared to other tools.
Correct. Correct. And here, you can have a group work. You can have a
Yeah,
group of
multiple.
people, and you can show the scenario, and you can take the reaction of each person, to see how each individual reacts to a particular scenario.
Yeah, decision making skills, problem
And
solving.
not just decision making, but even to assess ethics and professionalism that can be used.
Okay.
They are also used for decision making, but it can also be used for professionalism. I'll show you how. I have the examples also in the next slides. What about standardized patient encounter? Now that we have someone else tell me, we have two from one person. Let's have standardized patient encounter by someone else. Who would like to go for it?
Ma'am, Dr. Meenakshi here, ma'am.
Yeah, go ahead.
Yes, ma'am. Ma'am, standardized patient encounter is mainly used to evaluate the students' professionalism and communication skills with their team members and how effectively they are working with allied health professionals. So this is one of the tools which is commonly used to see the interprofessional behavior of the student, if at all if they are in the group.
Correct. And you need to train that patient. The standardized patient is someone who's normal, but he has to, play act. So most of the time, standardized patients are actors, who are taken in, for help. Anyone wants to add anything to this?
Madam, standardized patients are usually used in OSCE also.
Yes, perfect. So it can be, so this kind of a professionalism need not be a standalone thing. It can be a part of the OSCE, and you can have a small component of professionalism. Like in mini CX also, you don't have to have a whole mini CX dedicated to professionalism. It can be knowledge, all that, and you can add professionalism to it.
Even we can assess students' reaction to patients' behavior.
Perfect. Absolutely. Very nice.
Ma'am, here the assessment is basically the actor himself will give the feedback how the student is giving or how is he professionally competent kind of.
Correct. You're right there. So I mean, there is an observer. The observer also uses the checklist and or any other form of assessment, and the patient also is trained to assess. So it's a multi directional. Very nice.
But
I'm so
ma'am,
happy.
but ma'am, this won't be a biased when we have to assess based on the standardized patient.
Why
Patient
should
is
it
an
be
actor
biased?
actually.
Patient is an actor. Most of the time, the patient is an actor, or your own student whom you have trained. You know, your own PG whom you have trained. That way. All right, then let's move to narratives. Narratives. Anyone got anything on narratives?
Ma'am, narratives are like a reflective writing, like what you can write on a given clinical scenario or the settings. So a scenario is given, how a narration can be made out of it. So how an assessment happens here is the faculty or the mentors review this narration and discusses with students.
Correct, correct. So it's a narrative where you show a scene, you show some kind of a dental practice which is good, bad, ugly, and ask them to write a narrative about what they saw, and related to that narrative, they can write a reflection. What they think they saw, that is a narrative, and then they can reflect on what they saw. Very good. Thank you. Multi-source feedback.
Narration is not given to the student, or the student himself has to narrate and then reflect.
Yeah, either way. You can give a person, the student, a narrative to reflect on regarding a case, or you can give a sort of a case and ask them to write a narrative about the case or what he has experienced in the, say, ward or in the OPD, and he writes the narrative and then reflects on it. So you can use it both ways. Both ways. Then multi-source feedback. Yes.
Madam, I would like to speak on multi-source feedback, madam.
Please do.
Basically, madam, multi-source feedback gives us a blueprint how to assess professionalism and ethics, madam. But the first thing that we need to do is we need to identify who is the stakeholder in this, whether it's the student, whether it's a faculty, or whether it's the patient itself. Then we have to set down the criteria for checking the professionalism. Then we have to design a feedback for the relevant feedback based on the stakeholder we are choosing.
Yes.
And the feedback questions are usually consisting of open-ended questions or any rating scales. Then once the feedback is collected, we need to do the analysis of the feedback, share the feedback to the relevant stakeholders itself, madam. Then after analyzing the feedback, we have to set the goals and targets, how we can achieve whatever we are trying to achieve, whatever professionalism criteria we have set, how to achieve that. Then with a period of time, there is follow-up of that, and again reassessment is done on it. Then the same feedback is used for further decision making, how to improve.
Correct. Correct. And multi-source means you will also be sending it to the ward boy, to the Ayabai, to the people who help, the technician. You will be giving that feedback for all. So it's a 360-degree. Multi-source is also known as 360-degree feedback.
It may include the person who is being assessed also. He himself can give a feedback on self-appraisal.
Perfect. Very good, self-appraisal. Very nice. Yes. I'm so happy all of you are participating.
And this involves both self-assessment and assessment by the others, like the providers or teachers. They can assess in both ways. The benefit of this involves it increases the self-awareness, and it clarifies the behavior. It promotes the dialogue, and it improves the working relation. Then it encourages the personal development, and it enhances the performance of the person.
Perfect. Very nice. Well said. So give yourselves a clap, pat your backs. Pat your backs. Shabas. Wonderful.
Thank you, ma'am.
Wonderful. Very nice.
Thank you.
So we see how we can develop these things in our own workplaces. You don't need, this is not rocket science, and you can use it. So I have just one or two slides on each, so that we can just quickly go through it. This is the Miller's pyramid, and when it comes to the mini CX, it sort of tests the shows, where you can have either in an OSCE a mini CX. And what is the mini CX involved? It has all these skills that it is talking about, medical interviewing skills, physical examination skills, professionalism, clinical judgment, counseling, organization and efficiency, and overall clinical competency. So it has these 7 domains, so to say, clinical mini CX. And it has a grid which you can tick, depending on each, like this. It has all these skills that I just showed you, and then it has the assessment grid. Okay, and I have taken this from Education from Health, Introduction of mini CX in undergraduate dental education in India. This is this paper, which is a 2014 paper. No doubt it's a little old, but the principles remain the same. So I thought I would show this to you all. And it talks about, what is unsatisfactory behavior, satisfactory and superior. And here I will like to explain this professionalism. What is the best behavior? That shows the highest degree of respect, compassion, sympathy, empathy, establishes trust, attends to patients' needs of comfort, modesty, confidentiality, information throughout the mini CX encounter. So when you are testing the examination skills or the interviewing skills or the judgment, that time, how much professionalism that person is showing, you can test. So this is how you can use mini CX. All right. And then about the vignettes. This is an example where you can give these vignettes to students. And see, this is one scenario. You have been offered the opportunity of working on a final year research project with Jenny and Karen. Would you agree enthusiastically, agree but insist that you each take clear responsibility for one aspect of the work, argue that you would prefer to work alone? See, this is a vignette. This scenario is known as a vignette. Okay, this is the scenario. And then you can ask them what action and ask people to opine. So this way, you instill into people the notion of professionalism. So question is, are often based on vignettes or clinical scenarios and may involve the description of critical incidents. Vignettes have been used to assess attitudes of dental students towards socially acceptable and unacceptable group working practices. And this I have taken from, of course, an old paper, 2007, but again, nothing, I mean, it's not that professionalism will change. So the attitudes of dental students towards socially acceptable and unacceptable group working practices. This is a very good paper and I really enjoyed reading it. So these are parts, And one more vignette, I'll just give you an example. You have been working on a group project for which you have produced a single report. The tutor has indicated that all members of the group will receive the same grade. One of your fellow students has repeatedly failed to help you work with it. It happens so often, no? In a group, when you're working, there is only 3 out. If there are 5 people in a group, 3 people will work very hard and 2 people will just, not do anything. So these are ethical issues that we need to find, because see, the tutor has said same grade will be given. So what will you do? Now, this is an ethical dilemma that people will face. You and I have faced it so often, You will ask the student to remove his or her name from the report. Tell the tutor that the student has not contributed to the work. Remove the student's name from the report. This is what we need our students to think, debate, ask, and see what should be done. There are always shades of gray. No answer is absolutely right or absolutely wrong. Okay. This is a very good paper. Right? It's 2003, but I enjoy you can read. They have also given the answers to what can be done and suggestions to what can be done. Right. And this is one more. See, this is something that happens again with us. Paul and Mike live 50 miles apart but keep in contact via email. They are both studying on the same GCSEs, same examination, and have been asked to produce 2 similar projects. They agree to complete one of the projects each, and then they want to swap the projects because there is no chance of their teacher finding out. This our students do. They go to the net, they do things, and they just find out where some project which is similar, pick it up and copy it completely. We've seen that happen very often. So we by using these vignettes, we can inculcate into the students that ye theek nahi hai. To do something like this is not going to help either of us in the long run. They may not know also. The teacher may not come to know also. But yet, it's not a good thing to happen. All right. So many of these are there. For paucity of time, I'm not showing you every one of them. But standardized patient encounter. In this, we have to remember that interviewing, counseling, getting a rapport with the patient, personal manner, satisfaction, all this will come into the standardized patient encounter. And they have to be trained. I've said this, and used to assess aspects of professionalism, which has produced valid and reliable results. And the assessment is completely standardized, remember, and it occurs in an artificial environment and therefore may not reflect day-to-day clinical performance, but it can be used to train our students. Videotape. This encounter can be taken on camera, and then it can be shown to the student again, so that you can have a proper training done. Then, as far as narratives are concerned, you need to tell or teach our students how to write a narrative, or give them a properly written narrative to reflect on. So, and then you have the reflection progression framework, which you can find out, the 5 R's, so to say. Reporting, describes without reflecting. Responding, limited justification of the lessons learned. Relating, evidence of lessons learned. Reasoning, analysis factors from experiences. And reasoning, deconstructing, integrated previous experience with current events and data to inform further action. So this is how we can use reflection, and we can assess reflection by finding out in which of the 5 R's this reflective writing piece happens. So R1, R2, R3, R4, R5. And then you have the written assessments, which can also be used, to assess the reflective ability. And then you have many tests that are there. And these instruments like defining issues tests and moral judgment interviews, etc., were used way back, even in 1985 in dentistry, with quite a lot of success. So this kind of an assessment is not new to dentistry also. So written assessments are particularly useful for assessing students' knowledge. So you can have a written assessment, and you can have a construct. Okay. And then, of course, there is the multi-source feedback. High peer, high self, low peer, low self, high peer, low self, and low peer and high self. You can, you have many ways in which you can assess. And as I think, I don't know who it was, I think Narendra mentioned self-assessment. And yes, so self-assessment is very much a part of the multi-source feedback. So written so the assessments per se can be written, they can be competency based, they can be performance based, and they can be also portfolios. And they are very complex and you can use them. There are many attributes that you would use, and you would use these that I have already shown you. So I don't want to use too much. But competency based dental education also, now that all of us are moving towards competency based, we have a lot of competency based assessments that can be taken into account. And as I think again Narendra mentioned OSCE, and someone else also mentioned OSCE. I forget the name, but you can use OSCE. And when used to assess professionalism, there are problems with the interpretation of students' behavior from differing assessors, even when calibrated and well trained, you know. So you have to see to it that you train your assessors also. Only then will it help. I'm just repeating this slide here. So what are the key issues in assessment? Professionalism must be evaluated as explicitly and rigorously as other competencies. Information and assessments must be gathered from many stakeholders. Evaluation be formative, provide feedback for improvement. Multiple methods can be used. That is why I exposed you to at least 5. And the 6th one was the written assessment. So, you know, you now are aware that you can use these 6 methods to assess professionalism. Well-designed system of evaluation required to integrate and synthesize evaluations from multiple sources, courses, and rotations. That is very important. And we can stop here, but I can take questions. So remember, Stern said, our failure to measure professionalism sends a conflicting message to both students and practicing physicians. When we profess and encourage professionalism, we do little to ensure its presence. I will stop sharing here, and I would like to have your views on assessment and proficiency. Where do you think you can use it? I don't know which specialties you all are, but do you think that in each one of your specialties you'll be able to use to assess professionalism? Can you think of a small project that you can do?
Madam, we are all from the same profession, same specialty.
Yes. Correct. I'm sorry, yours from the same specialty. Yeah, I realize.
And one thing what came to my mind is, if we are doing this assessment of professionalism actively, wouldn't the behavior of the person assessed change? Because he wants to, if he knows that he is being assessed, so his behavior and his ways may change.
May change for the good, right?
Yeah, for the good.
So very good. Even if he's acting, thoda to uske usme jayega, you know, you understand that? Whatever happens, at least that little thing and that checklist, some people used to say in the beginning, we will not give that checklist to people. Oh, then they'll mug the checklist and come. De do na usko. Mug karke wo aisa acha kaam kar raha hai to karne do na.
So this should be used in the formative setup or a summative way?
Both. And you use it in the formative, so you train them and you give feedback, and then you use it in the summative. So, you know, it is not like a surprise कि एकदम से अरे ये कुछ लेके आया कागज और टक टक किया और मुझे fail कर दिया. They are exposed to everything.
Ma'am, my question is slightly weird. Can we have this professionalism assessment for the stakeholders? What I mean is the institution, that starting from the institutional heads, then come to the teachers and sub people, because we become the role models for them to know, at least to start with. So how this can be established in the institution?
You know, what you could do is, when you're actually talking to a patient or anyone, the checklist is there. You can ask the people, like how I, you know, in the beginning when I was teaching, I used to ask one of my friends to sit in my class and say, just see how I talk and how I teach. And there were times, so many positive suggestions came, and I changed. First of all, I used to be so nervous that I used to talk very fast, because I used to feel कि चलो अभी खत्म कर डालते हैं, कब भागू ये class से. I'm talking about now. I've been teaching for 38 years now. So this is way back 38 years ago that I'm talking about. When you first enter classroom, you are also very nervous. But then slowly I learned how to take it at a pace, how to with people telling me, से क्या एकदम फास्ट ट्रेन की तरह बोले जा रही हो, समझ आए नहीं कुछ. So then I learned, to stop, to go slow. So similarly, you can also use this grid, and the same way as I just told Narendra, that if you use that grid and try to internalize it and use it on your patients, automatically you will have professional behavior, and ideally then, as I said, with standardized patient encounters and all that, and especially if it is a part of OSCE, many of the OSCE stations are, nowadays videotaped. A skill station also, if you have a simulation lab and you have a skill station and you have, some person pretending that this mannequin is alive and talking to the patient, you can inculcate professional behavior in your student, in your stakeholders, in all the people. Of course, if you ask your dean and say that I am going to evaluate you, your dean may not like it. I mean, your stakeholders, like it's everyone.
Madam, assessment should be top down and not bottom up.
Yes, yes. So you could do that also. Why not?
Will we really get the responses, ma'am?
Pardon?
Are we really going to get the correct responses then?
See, that is the problem with the system and with the place that we are in, all of us are in. It is always तुम करो, तुम ऐसा करते हो, but it is never like मैं भी ऐसा शायद करता हूँ कभी कभी. Very difficult for us to get that acceptance, and I have also learned, as I told you, when I came out saying a sorry, it took a long time for me to do that. I have trained myself to say that over a lot of time. It was not coming so easily to me. It's I think only with time, my age, my the fact that okay, but when I was younger, my ego would come in my way, and I would say, what the hell, इतना खराब काम करते हैं और मैं क्यों sorry बोलूं? You understand, no? It is all a thing of time, space, maturity, age, and ठीक है. अभी मैं I mean it didn't hurt me now, but I'm telling you, 15 years ago you had made me do that, to say a sorry for what I said, it wouldn't have come so easily to me. See, all
So
of
this
us
is
are
also one
human.
of the challenges, ma'am.
Yes, it is one of the challenges, and it is
Because early in our careers, it's very difficult to implement so many things.
Absolutely, I agree. I agree. And sometimes, having said sorry, it may be people are afraid. I mean, you may be afraid. It may be taken as a symbol of incompetence.
Incompetence, yes.
It happens, no? कभी कभी हमको लगता है कि अरे हम क्यों सॉरी बोले, और हम सॉरी बोलेंगे तो उसको लगेगा कि अरे वो झाड़ पे चढ़ जाएगा, इस कि नाउ नेक्स्ट टाइम तो दे विल नॉट कम बैक ओनली. ऐसा भी पॉसिबल है ना? We do think like that, but if you have not much to lose, na, bol do. See, if you want other people to work, now see, there's some technician who's always there and he's handing over all the material to you. You're doing the work, or you कुछ गलत दे दिया और तुम गलत किया कुछ थोड़ा सा, तो तुम्हारा तो दिमाग फिर जाएगा. as far as the dental work is concerned, and it's so fine, and it needs a lot of precision. So you will go crazy, you will maybe shout. Later on, even if you don't want to say this in front of all the people, later on you can take him to the side and say, okay, one to one तो बोल ही सकते हो ना कि अरे नेक्स्ट टाइम ऐसा मत करो, लेकिन एंड आई एम सॉरी, मैं इतना गाली नहीं देना चाहिए था. And slowly then you realize, okay, and then that person works for you, and then is very careful for you with everything that is done, and then you feel so happy that there is a change in the person's attitude. So फिर ना you start feeling good about it, and you realize that these little things of correcting a person and at the same time correcting myself has gone a long way. It has helped to change the system.
Madam, has this been incorporated in the CBME by NMC?
We do a booklet called ATCOM, where we have attitude, ethics, and communication thing, and where we have each phase 1, phase 2, phase 3 undergraduates. They are given some vignettes, clinical scenarios, and we talk to the students, and we sort of have dedicated sessions related to this. So it's there. And even in biochemistry, what we try to do is, as far as this competency base is concerned, I will give a scenario. I will write 4 questions related to biochemistry which they should know. My 5th question, 5-mark question रहता है. If it is a case based, I will give them that scenario. I will ask 4 questions related to biochemistry. The 5th question will be, how with these kind of biochemical problems and values, how will you counsel the patient? Would you call the patient's family and talk to them also? And what will you do about it? So the students are thinking कि अरे इतना उसका sugar high है और ऐसा है, so then the wife or whoever is looking after the food habits, the lifestyle of the person, you also bring in the family, because remember, any disease or anything that goes wrong with, as far as dental also is concerned, if there's something grossly wrong, you need to I mean, we are not in silos, we are always with people. So you need whatever is happening has to be communicated, and you have to teach the students to think. So 1 mark mera waste nahi ja raha if I insist, I always ask this kind of a question where students will think, and they don't have to mug. They will think कि मैं क्या करूँ इसका, So, and 1 mark in a 100-mark paper, if not 1 mark, because I will ask like this for 3 or 4, not same type of question, but some kind of a thinking question कि तुम क्या करोगे professionally or ethically. That kind of a question, when it is asked for at least 2 or 3 times, I feel somewhere it is going to, at first, I'm a biochemist, so first year I teach this. So it starts getting inculcated. People start thinking कि अरे हाँ ये भी family है. Or I will say, what would you have done if you had in your aunt had come to you with this kind of a scenario? Somewhere I think if you give that thing of the family, whenever I take lectures on lab and things like that, good laboratory practices also, I make it a point to tell them that every sample that comes, you should think that it is the sample of your mother, and treat it like that. ऐसे ढकलो मत उसको, because it is someone's mother's sample or father's sample or whoever, some relative whom you are testing. So treat it with respect. Treat it with the feeling कि तुम्हारा अगर mother's sample had come with such values which were just unnecessarily, and someone starts treating the patient like that and wrongly, how would you feel? So ऐसा बात करते रहना चाहिए बच्चों के साथ. You have to keep on talking. It was not कि एक scenario दिया, एक एनकाउंटर दिया, एक ये ऐसे किया तो वो बस एकदम भगवान का हो गया, you know, like he's become like a saint. We don't want saints also. We want people who are, you know, have their shades of gray. And nowhere in the world, otherwise I always feel we would not become human beings, no, we would have been somewhere else right now. इधर आते ही नहीं थे. So I mean, just for the sake of saying, but these are things that we need to talk, tell us. Anything else that you all want to talk, discuss, or anything that is troubling you?
Ma'am.
Yes, not just related to, you know, ethics and all, anything else. Yes, tell me, Shilpa.
Yes, ma'am. If the other person is not professionally dealing with you, but you are right in your part, then how do we actually have a dialogue?
Yes, that is actually conflict management. You know,
Yes,
you need, first of all, I feel, this is what has happened to me. Or I mean, as professionals, when you are working in a work scenario, it happens not all the time, but with everyone.
But most of the time.
Yes. Okay. So you should, I think, ek to internalize, don't react immediately. Let one whole day go. तो तुम्हारा भी दिमाग ठंडा हो जाएगा, and you will also have assessed and think कि where else have I also faltered. Do a self assessment or a self appraisal कि थोड़ा मेरा भी गलती है कि नहीं. But if you feel बिल्कुल कुछ भी गलती नहीं है, and if the person is ready to talk or say something, you can of course have a dialogue. But sometimes there are very difficult people who will say, I will not let entry of this person in my room. You keep sending a chit inside, the person is throwing it out and not at all letting you go in and talk. Then at that time, you could use a conduit, you could use someone who knows this person, and you know, try and put forward this, so you can have a mediator, you know. At the same time, you have to try to play safe, because that person's ego, the fact that the person is not letting you in only means kidhar to that person has had a very bad ego tussle. So you have to find out whether this person will like this kind of a liaisoning, you know, because some people may say, kya chugli karti hai? Why, how dare she go and tell this other person? You know, these things will happen. So you have to take it by the situation, by the year. And if you happen to find this person somewhere in an informal situation, you can start by just smiling and by just sitting there, you know, near the person, and you know, things can work. But these are difficult situations, you know. There is no right answer for this, and you have to be persistent and try not to be rude. Try not to talk about the incident to 10 other people who will use that incident by you to try and get into the good books of that person. You know how it is, no? Human beings also play their games. अरे ये तो आपके बारे में ऐसा बोलती थी, ये ऐसा बोलती थी, ये हुआ, वो हुआ, and then that person will get all the more biased. So we have to also learn to contain ourselves and understand, and also it depends on what hierarchy that person is. If that person is at that hierarchical situation where, you know, can make or break you, then somewhere you have to understand and think कि ये job मेरे लिए कितना, am I enjoying my job? Maybe not this person, but am I enjoying what I am doing? You know, I always take a paper and pencil and write pros and cons about a situation. I have got into that habit of doing this. क्या ठीक है मेरे लिए, क्या नहीं ठीक है, and what is troubling me about this person? And if, or what is on the right hand side, which is what is troubling the person, is a little less compared to my job, my work colleagues, the fact that it is giving me enough money to, let's be practical. We need the money also, na? तो अगर मैं छोड़ के जाऊंगी तो someone will take me in another job at the starting level, at the starting pay. Is it worth? No. So you have to sit and analyze the situation, and the more you just keep quiet, let time be, and you work sincerely and work, people will realize कि इतनी भी बुरी नहीं है रे. मुझे लग रहा था, I mean, I have done that as a head, I have said, oh my God, all the time I felt that this girl is so horrible, but no, she did this so well, so somewhere that person will feel like that.
Yes, ma'am. Ma'am, but if the person is like a colleague, like if they are my own colleague, or if they are junior to me, then we can have a dialogue. But if they are senior to us,
yes, that's
it
what
is
I said.
difficult to
No,
have a conversation.
with the senior, it is very difficult. So you have to try and do it by your actions, and not let this bias trouble you so much कि मैं अभी काम ही नहीं करेगी, अभी मैं उसको respond ही नहीं करेगी, देख मैं कैसा करती हूँ. Don't do that. You pretend that nothing has gone wrong. No, that person only will start feeling, अरे मैं इतना बोली उसको कुछ लगा ही नहीं, क्या she's wearing a armor or what and doing. तुम तुम्हारा काम अच्छी तरह से करते रहने का, and the person only, hopefully, if that person has enough sense, so it's a losing situation, but you have to then deal, you have to live with it. You can't help it if this person is going to be adamant. But as I told you, if whatever is good for you is there, your other juniors and all are very happy and you are enjoying yourself, you are going out for a cup of tea to the canteen with your juniors and enjoying yourself, ठीक है ना? See, we cannot please everyone in life, and that is a fact. How can you say that you are, I mean, how will anyone and everyone say you're well? Impossible. Human nature is such. So don't expect it only.
Yes, ma'am.
Okay. Just psych yourself into that, and you will attain ekdam enlightenment, nirvana. Anything else? Any other comments? All right then, Dr. Nagda, can we call it a day, a night? Thank you for being there. I know all of you are very busy.
Thanks a lot, madam.
Thank you, ma'am.
Yes, ma'am. Thank you so much, ma'am.
Nice meeting you all. And yeah, bye bye.
Yes, ma'am. Nice.
Yeah. Bye.
Bye, everyone.
I think I'll just tell Dr. Nagda that.
Hello? Yeah, actually I could not get it because वो silent में रखा था ना. I tried to press the button. Something else happened.
Okay.
Hello, can you hear?
Yes. So I was just telling.
Can you hear me?
Yes, we can hear you. That's what I was just trying to call you.
Can you hear me?
Yes, I can hear you.
Yeah. So thank you so much, Sucheta.
Thank you. So much. Pleasure always.
Yeah. Thanks all of you.
Yeah. Bye bye.
And next time again, I think we continue with that competency based, and I will keep you posted what session is there. Thank you. Good night. Yeah.
Good night.
Good night.
Bye bye.
Yeah.